staying healthy, staying sexy, staying young is what living life is all about. And if you have doctors that have proven treatments that keep people young and healthy so they don't get sick, you want people to know about these treatments and that they exist.
This episode is brought to you by GainsWave. GainsWave is a treatment done at your doctor's office to optimize erection quality without the need of Viagra, Cialis. It's non-surgical, there's no needles, and it has an amazing success rate. To find a GainsWave provider, go to gainswave.com. That's GAINSWAVE.com. This is Mark L. White with Health Hacks. And today we have Dr. Joel Gator Warsh. So really the first question I have for you is tell me about Gator.
It's a great question. So my wife's last name is actually Intelligator. So people started making the joke, oh, Dr. Gator. It has nothing to do with Florida. I grew up in Toronto. But people always ask if that's to do with Florida. No, nothing to do with that. I'm in Los Angeles, but it's just my wife's last name.
Okay, so nobody, I bet you've been, people have come up to you, asked you if you've been to the University of Florida and...
Yes, yeah, they think I'm a big Florida fan and not against Florida in any way, but nothing to do with that.
Now, you're an integrative pediatrician. I have 3 kids, and we live a healthy lifestyle. My wife's Colombian, so she's into traditional integrative ways of doing things. And the biggest surprise for her when she came to this country, first of all, she said, my God, all the kids in the US are fat. And second of all, she couldn't believe how many pills kids are given for everything. Mm-hmm. I guess my question is, like, why did you decide to get into integrative pediatrics, and why isn't it a bigger subject here in the US?
That's a great question. So for me, I always love working with kids. So I always knew when I went to medical school that I was going to be a pediatrician. But what I didn't realize was just seeing all this chronic disease and the way that medicine really has moved, where we focus a lot on treatment and not a lot on prevention, and we don't think about the root cause. And I got really frustrated with the regular system and the super short visits. It was really hard to do anything meaningful in my mind, or a lot of meaningful long-term discussions when you only have 2 or 3 minutes with a patient. And also, really the only thing in our toolbox, it was medications. That's what you learn. And I'm not against medications at all or Western medicine at all, but I had seen so many patients go to herbalists and naturopathic doctors and Ayurvedic practitioners, and after years of having chronic disease and get better. And that sparked me to say, hey, there must be something else out there. Why have we not learned any of this? And what am I missing? And so that's what really led me down a path to start learning more of these alternative therapies and alternative methods, being like supplements and other things like that. And again, I'm not against Western medicine at all. I just think that there's a time and a place, and there's so many times where there might be something natural out there that you could do first before jumping to a medication. And if you have, maybe a bad pneumonia or something like that, yeah, you probably need your antibiotic, but most of the time you don't need that. And if you know about some of the other traditional therapies, then maybe you can try those things first. And most of the time you never need to get to a Western medication.
So do we have an obesity crisis with children in the US?
Oh, absolutely. And the obesity rates and overweight rates just continue to go up and up and up. It depends where you look and what research, but you see 1/3 all the way up to 2/3 of kids have overweight or obesity, even higher in some studies. So it continues to increase. And even more than that, we have a chronic disease disaster in America. In the CDC quotes some around 25% of kids, but I've seen lots of studies that showed up to even 50%. And there's definitely studies in adults showing that it's getting to 50% or more at this point have a chronic disease, have something that's lifelong they need to take a medication for, or that they're dealing with every day. And that's an epidemic beyond anything that we really should be dealing with. Somebody should be sounding the alarm on this, and nobody really is, and that is extremely frustrating.
Why aren't kids isn't the solution just eat better, stop drinking soda, stop eating sugary foods? I mean, isn't that pretty much the solution to it? Or are there other things going on?
It's a big part of the solution. The simple things are the most impactful. And for me, I have a saying or an acronym is called SEEDS, the seeds of health, or the foundations of health. So S being stress, E being environment and toxins, the other E being exercise, D being diet, and the final S being sleep. So as you mentioned, the simple things are the biggest factors in what we're doing to contribute to this chronic disease. And we have kids eating way too much sugar, way too much preservatives. We're eating all sorts of chemicals in our food. We're surrounded by toxins, and all of these things are contributing. It's probably not one thing. It's so many factors. Our bodies are just becoming overloaded, and kids especially, they just can't detoxify and they can't handle all of these things. And so that's why we're seeing so much chronic disease. And everybody has different genetics. So some kids are more resilient than others, and some kids can handle all of this or most of it, but many kids can't.
So it's, let's talk about that first one, stress. And the biggest change, obviously, in our lifetime and with the generation, like I have an 18-year-old, a 15-year-old, and a 12-year-old, is social media. So my youngest daughter says to me the other day, she's like, Daddy, I wish I didn't have social media. It's too stressful. And I said, well, why don't you turn it off? She goes, I can't. And she goes, if everybody turns it off, it would be great. But if I'm the only one who turns it off, I won't know what's going on. And, they know the other, they stay up late, they don't get sleep, but they're so involved in social media. Is this, like, do you see, should we be sounding the alarm the way we've been, you said we've been sounding the alarm in obesity. Should we be sounding the alarm in social media and the use of iPhones?
Yeah, definitely. No question about it. I think that's the problem that you mentioned with your child about how it's such a hard thing to do, because I think a lot of us are thinking the same way. Like, I would turn it off, but I just can't. And myself as a doctor, I think that way all the time. I wish I could turn off social media, but I need to be kept informed of what's going on to help my patients. And that's where you get a lot of your information and a lot of news, and you can also see what parents are saying. So it is a huge benefit in terms of knowing what's going on and also having your pulse on what's happening. But at the same time, the stress level is just going up and up and up. And people are so angry online these days. It's all lots of fighting. Nobody seems to be able to agree to disagree. And the stress level is just beyond, especially for kids and teens who, you're seeing maybe not right now, but in general, you're seeing people doing all sorts of fun stuff out there, and it makes you stressed out, and you're wondering if you're not included. And there's all sorts of social media bullying. There's all sorts of pressures that we never had before. And it just seems to be getting worse and worse and worse with each year.
Yeah, I know. It's like if my daughter posts something, she wants to know how many people like it. And I'm thinking, why do you care? Like, why do you care what people like, don't like? She gets excited. But I think the other thing is that people paint these pictures of themselves on social media that aren't necessarily true. And as adults, we know that. But as kids, it's like, it's very stressful.
Yeah, social media is somewhat similar to looking at a magazine cover, right? I mean, those things are Photoshopped. They're not real, but that's what you're looking at, and that's what you're comparing yourself to. And that's very true on social media, where people post a picture of them with the big smiles, having the best day ever, and really it's the only time they've smiled the whole day, and they're actually having a miserable, horrible time, and it's raining out or something like that. So it's just so hard to know what's real and what's not. And it's so, I think, frustrating for kids to try to be a part of this world and not really understand. And because even as adults, we don't really understand what this is doing to us. But most of the research shows that you're getting this dopamine hit every time you're scrolling through and every time you get a like or a comment. And so people are always looking for that fix, and we get so much validation.
A bing, you get a bing, and you're oh, who is it? You pick up the phone, a bing.
Yeah, and we get so much validation from that. And you make a post now and you usually get 100 likes, but then you get 1,000 likes. You're like, oh, wow, this is so exciting. So many people love what I'm posting. And that has become a part of us. And it was never there before. And it's not something that humans need. We don't need to have validation from likes in social media, but it's just becoming a part of us. And so the more that it gets ingrained into society, the more we need that fix. And just like any addiction, you need more and more and more to get that fix every time. And so I think it's getting harder and harder for kids to get that dopamine hit.
Yeah, so we're raising a whole generation of addicts. My son, my 18-year-old son, had his cell phone stolen yesterday. Mm-hmm. And today's like, I have to get a new phone. I said, you go get it with your money. You're now 18. I'm not paying for it. And he's freaking out because he has no phone.
Yeah. It's an appendage, right? It's a part of you now, the phone and the computer, but probably the phone, if anything. And there's probably no bigger punishment these days than taking away a kid's phone, I would imagine.
Well, going back to like, we know it's a crisis, we know it could be a crisis, but what are you telling your patients? Yeah, I mean, are you telling your patients put the phone away? Or what do you tell them?
So it's hard because you have to be realistic too. And if you're too hardcore with it, then they're just not going to listen to you. And then they're just going to think you're talking crazy talk and they won't do anything. So I think it's about setting reasonable and fair boundaries. And it's different with every family. So you got to work with the family depending on where they're at with this, how much of an issue it is for their child, how old their child is. Each of those things would factor in. But to me, a lot of times where I start is, instead of saying don't use it ever, because that's probably not going to be reasonable for most kids, is try to set some reasonable time during the day where you're not on your phone or not on the computer, or they're, it's just family time. So a lot of people, that would mean, okay, when we're eating a meal for that half an hour, no phones at the table, or no phones before bed for an hour, or no screen, whatever it is. So you can set some windows in the day where at least there's half an hour or an hour where you are not using your phone, you're not on that at all, and you're just doing something else. You're getting outside, you're having family time, you're doing whatever it is. And that seems to be more reasonable and doable for most kids than please don't be on your phone ever. They just won't do it. And then you request it, and then 5 weeks later, they're back to doing what they do. So if you can come up with some sort of schedule, and they have to buy into it. And I think if you can fill that time with things that are fun for them or family time, then they're going to enjoy that, and that's going to hopefully help it go longer and longer and longer with the no phone time versus the other way around.
Is there an age that you recommend that parents don't buy their kids a cell phone, or that kids shouldn't be there on the phone?
It's a good question. Everywhere that you read, it gives you different answers on that. I think there's one thing about cell phone and one thing about internet access. So there's the safety aspect of having a phone that a lot of parents, this is why they want to get their kids a phone. If you're going to be out, if you're going to be away from their parents, they want them to be able to contact you. So I think that could be a much younger age than a phone with internet access. So I've heard a lot of parents are going back to getting flip phones or special phones for kids where they don't really have internet access, or it's restricted. So they can use it to call for an emergency, but they can't use it to be online. So I think that's totally fine and reasonable at most ages, but at internet access, you probably don't need it, at least in your teen years, if that. Even Facebook and Instagram and a lot of social media, if you read their fine print, they have different ages, but I think it's like 12 or 13, where you're not even supposed to be on it before then.
Kids know how to get around that real easy.
Yeah, it's not that hard to get around it. You just change the
Put it in a different birthday.
Put a different birthday, but at least from their research and studies, that's what they have. And most of the owners and the CEOs of all these different companies, they all say they don't let their kids on social media. So they know that it can be harmful, and they're watching their kids very closely and keeping them off it as much as they can. It's
funny. Like when I was growing up, I would get distracted. I'm a curious kid, a little hyper, and they say, he's your average kid. Now they have a name for it, ADHD. Your kid has ADHD. He needs to be on Adderall. He needs to be on Ritalin. And I know that kids now, there's more distractions than ever before, but is ADHD, is that real, or is that something that's created by pharmaceutical companies to sell pills?
It's definitely real. There's no question that it's real. And there are absolutely kids that do benefit from medication and that do have very significant symptoms when it comes to behavior and attention. The bigger and greater issue to me is that we are very quick to give that diagnosis in America. So there are a small fraction of the kids, in my estimation, that really truly need the medication, and that's totally fine if you need it, and it makes a big difference for many children. But it's also very easy and quick for a parent to come in to a practitioner, and they might just do a couple of quick tests on you or questionnaires, and the teacher says, well, they're really overactive in school and they're not paying attention and they're getting really bad grades, and the parents say they're crazy and running around at home. And it's really easy to say, okay, here's a pill, here's a medication, do that and things will get better. And medications in general, they work really well and they work really fast, but the question is, what are the side effects of that? And
is it fixing the root cause? Because my understanding, and maybe you can help us with that, but is that diet causes a lot of issues, like the red dye and the artificial chemicals that we find in foods. So wouldn't changing diet fix a lot of these issues?
Great point. So for some people, yes, most definitely. And that, to me, as an integrative practitioner, that's where I start, right? That's where it's so important to think about what the root cause is and go through and do a full, thorough history, go back through, find out if there's anything going on with this child at home, any mental issues going on in the family where there's big changes, divorce, something like that, that could be contributing to this. Are there other medical conditions that could be contributing to this? Sleep problems and sleep apnea, things like that. And then also, you got to go through the diet. You got to go through what they're exercising. You got to go through what's going on around them, because there are 500 reasons that it could be where there are other things that you could do besides giving a medication that might make this child a lot better. And you might not solve the issue by changing their diet, but you might make their behavior 5% better. And then by getting a little exercise and making another 2% better. And then by taking some toxins out of their house, you make another 2% better. And maybe 10, 15% better. That's actually good enough for the child to be able to focus. They never need a medication. Or if they do need a medication, then maybe you can lower the dose or get them off of it. Or maybe there's some supplements that they could use instead of a medication that has lower side effects. It works just as well. So it just depends. For some people, you could change all their diet, you could do everything perfect, and their kid is still going to need the medication, and that's fine. But I think that's the more of the minority than it is the majority. And I think we're too quick in America to give a pill because it's easy, and it's really hard work to try to figure out what else you can do, because there's so many things that take so much time. And in the medical paradigm, most physicians just don't have that kind of time to spend an hour with a patient or 2 hours multiple times to really dive into this deep enough to get to a root cause, because it's like Sherlock Holmes, it's detective work.
Yeah, I also don't think most pediatricians are looking for the root cause. They're just troubleshooting. But like when a parent comes to see you, in your experience, are they coming to see you because traditional medicine has failed them, or are they coming to see you because the parents are into integrative health and you're seeing the child from being an infant all the way up into becoming an adult?
It's both. It's both. I get a large majority of my patients are parents that are very frustrated with the regular system, either with a new baby, or they have a baby on the way, or they've been through the medical system and are just frustrated with it, and are just frustrated with either being laughed at for their questions, or not being respected in their questions, or not just even not being able to have discussions. I think for them, a lot of the parents are just want to have discussions. Many of the patients in my practice are not, what people call like woo-woo patients that are out there and just, doing homeopathy and herbs. They want both. And I want both. It's just they want to know that if there is something that we could do besides the medication, then we'll at least think about it and talk about it. It doesn't mean that we're not going to do all the regular Western treatments. I do all the regular training, and a lot of times we have to do regular stuff, and that's fine. But they are looking to at least have the discussion and have the thought that maybe there is something more than just Western medicine. And it's crazy to me because people call everything else alternative medicine, but alternative medicine, Ayurvedic, Chinese medicine, it's been around for 5,000, 10,000, 3,000, however, whatever, many years. But
it's working for the Chinese, that's for sure.
Yeah, it's working for them, and it's been around for maybe 5,000 years. But Western medicine's been around for a couple hundred years, maybe, or depending on where you want to put the start point. So which one's really alternative? This is the new medicine. Everything else has been done for thousands of years. So maybe they know something that we don't, and maybe there's something in those thousands of years that's useful for us. And we are starting to see it to some degree permeate in like things like acupuncture. That was crazy 5-10 years ago in America. Would we ever do that in a kid? Would we ever do that? But now it's in hospitals everywhere. It's instead of pain treatments, because we have an opioid epidemic, you have people doing acupressure and acupuncture in the hospital, and that works great.
So acupuncture for kids?
For kids too, yeah.
Wow.
So there's acupuncture and acupressure. You can do acupuncture in kids. It's just that most kids won't be able to tolerate it, or they're going to be moving around, so they'll do more acupressure in the younger kids. But you can do it, and in Asia that they do it all the time. It's very commonly used for everything, pretty much, and they have great results. And I have lots of patients that go over to an acupuncturist for chronic headaches or chronic stomach aches or other things like that, and sometimes they get good results, sometimes they don't. But at least if you're going to do something, let's try that before you go on medication for 2 years.
Are there supplements that every child should be on?
I don't think there's any supplement that every single child should be on. I think every child is different, every situation is different, and the body is magical. It can handle most things and can balance itself out. So to me, I'm a minimalist in terms of what I want patients to do. And if there's something going on, then of course there are things that you could potentially try or be on, but I don't think there's anything that everybody should be on. If there's anything, maybe vitamin D, and everyone seems to be vitamin D deficient, but even that, I think it's still better to get it outside. So I don't know that everyone should always be on vitamin D, but if you want to do like a multivitamin, a vitamin D, vitamin C, probiotics, those are generally pretty safe. But do you want to be on the same multivitamin for your whole life? No, not really. I don't think that's a good idea.
I love those Fred Flintstone vitamins when I was little.
Me
Gave you
too.
a hit. They gave a great hit of sugar, and I guess they had some vitamins in there.
Yeah, it's amazing when you look back, or even you look at it now and you look at the ingredients and you're like, wow, there are so many chemicals. I have no idea what those things are. And there are, there's the list of the vitamins, but then there's a whole bunch of other things in colors and dyes, and those are interesting.
So I want to touch back on diet. I mean, I could talk about this all day because I'm thinking about my kids, but like refined sugar, right? And like what should kids stay away from? I mean, like we have sugar, the fat, the salt, like what constitutes a healthy diet in kids? And then you see things like the paleo diet. And then my daughter, she wants to be vegetarian, and my wife's like, where's she going to get her protein from if she's vegetarian? I mean, should we be looking at different diets for the kids, like these I want to call them fad diets, even though I don't believe they're fad diets, but what are your thoughts?
Yeah, I'm not into any specific kind of like fad diets. I don't think that's a good idea for any kid. You need to have a well-balanced diet. To me, it's about eating healthy, eating real food, eating things that you could have picked off a tree or you could get in a garden or that were treated very well. I think that to me is where the diet is. If it has a fancy picture or it's in the middle of the grocery store, it has lots of preservatives and chemicals, then that's not going to be healthy for you long term. Now, can you have some of these things sometimes? Sure, you can. I'm not 100% like, oh, you should never have cake if you're at a birthday party or something, that's fine. But if you're eating healthy 95% of the time, preparing your food 95% of the time, that's going to be a huge difference. And you can be extremely healthy being a vegetarian or a vegan, or you can be extremely unhealthy being a vegetarian or a vegan. It depends on the kinds of foods and where you get your products from. It's a huge difference in nutrient density from something you grow in your garden or a nutrient dense soil versus something that's not organic and has traveled a week from some other country and then you're eating it a week later. I mean, it's still better than eating something processed probably, but it's nowhere near the same. And so that's where we're running into a lot of trouble. It's just getting back to basics really, and just eating an apple, a real apple.
It's like, yeah, eating what's actually natural. Like I kind of have a rule, like I'll look through the ingredients, and if I can't pronounce something or I don't recognize something or it's got more than 6 or 7 ingredients in there, I'm not buying it.
Yeah, and that's exactly what I tell the kids in the office too when we talk about food labels is turn the box over or what the bag or whatever it is, look at it. And if there are ingredients on there that you don't know what they are, or it's super long and it's not an actual word, then that's not going to be good for you. There's just no way it's going to be good for you. Doesn't mean you can't ever eat that, but that's not the things you should be buying. If it says, cashew and raisin and almond butter and words that then it's probably going to be reasonably good for you. There obviously is variations in the quality, but if you make those small change to just eating things that you know what they are, you're going to make a huge difference in your life.
Now, I think the other thing, you mentioned it before, kids need to play outside more, but you see all these kids, they sit inside, they play video games, they're not going out. Exercise, I know it's a huge problem, but how do you encourage a child to exercise?
A lot of it is finding something that they're interested in. So one, it has to be parents need to model the behavior and have to get outside as well. So either you go with them depending on the age, or you have to really try to work with your kids to figure out what it is that they love, because you don't want it to be, exercise like, oh, we're going to go on a spin bike and we're going to sit here for 2 hours, or, oh, we're going to get on a treadmill. For some people that works great, but for kids that might not work. So if you can find a sport or an activity that they love, great. If not that, then maybe you can teach them how to garden and get them outside and moving around and learning where food comes from. All these things are possible. There's absolutely no one answer for what is the best way to do it. You got to know your own kid. You got to talk to them. You got to work with them, try different things, and find something they have that they think is fun. So if they're having a good time, it's not exercise. It's exercise, but they're not thinking like it's exercise. They're just doing it because they enjoy it.
So I'm thinking like the kids that need to be seeing you, I assume have parents that are unhealthy, because if the kid's overweight and he's having problems, but like, do you ever have like unhealthy parents, they live poor lifestyles, actually will take their child to you? Or is it?
Sometimes yes, but I would say the vast majority are health conscious people that are coming, because I think even just to look up integrative pediatrics, or to look up or to be interested in what I do, you have to have some sense that this even exists. I think a lot of people don't even know what the word integrative means, or they don't know what the word integrative pediatrics is, or they don't even know that it's available to them, so they're not really searching it. So I think I have a very self-selected population, just given where I am and what I do. But there's certainly the odd people that do, and a lot of times it's someone who's been through the system a lot, and they're not healthy, and then maybe one of their family members is like, hey, I went here, you guys should go there. Or one of their friends is like, what you should try is try integrative medicine. And so those are usually the families that might not be the healthiest, but they're now open to learning. And then it's not a child teaching, it's then a family issue. And then we can work on the whole family to get the whole family a little healthier.
Are there a lot of integrative pediatricians out there, or is it pretty uncommon?
It's not that common. I hope it gets more common as we grow, but even in Los Angeles, which is a pretty big city, I can count on probably a hand, maybe two hands of people that integrative medicine. It's just not a common field, because with medicine, you have so much training as it is that most doctors, when they're done, they're not going to go back and do more training. And there's not a lot of specific courses and things like that you could take. It's not like a fellowship in integrative pediatrics, really. There's some integrative fellowships out there, but not really a ton. And most people are not going to go back and do another several years of training for this. So it's really on you to be interested in and then learn about it.
Do you ever have like traditional pediatricians who, like, when you tell them what you do, they raise their eyebrows and then they kind of imply that you're not helping? Or do people ever think that what you're doing is taboo somehow?
Oh yeah, definitely. All the time. I mean, anything, it's not even just what I do. I think anything in the integrative medical world is taboo to some degree. I mean, there's obviously a wide variety of what people do within the world of integrative medicine. There are some integrative practitioners, maybe not, not necessarily even doctors, but maybe some doctors, but let's say naturopathic doctors that are out there that do some things that are way outside of regular medicine and could even be dangerous. And that's not good either. But and I think that's what a lot of times you see in the media is, somebody does something super crazy that's way out there, and then that kind of turns everybody off to all integrative medicine and all supplements forever, and they don't really realize that there's nuances.
But at the same time, you have all these obese kids with diabetes and stress through the roof, and nobody's talking about that. And that's the traditional medical system. It's crazy.
It is crazy, and there's such a disconnect. But over the last few years since I finished training, I would say I feel like doctors are starting to become a little bit more open to it. They're not necessarily open to the word integrative medicine, but they are definitely getting a better understanding that what we are doing is not working in terms of chronic disease. We are great at treating emergencies, and we are great at treating acute illnesses, and we are great at many things in Western medicine, but we're not so great at chronic disease because we're really not focused on it. And the current paradigm of medicine, the really fast visits and seeing a lot of patients, it just doesn't lend itself well to dealing with chronic disease, because you have to spend a lot of time, and that involves either a different setup for doctors or teamwork. You don't necessarily as a doctor need to spend an hour with your patient on diet. You can have a nutritionist do that, or a coach or something like that. And I think that's fine, but it's about recognizing that we just can't do everything, and setting up a new system where there's teamwork, where we work with these other practitioners and say, hey, you have a problem with your weight, and that's not healthy, and we need to get you set up with a nutritionist or with and they have to spend a few hours, but someone has to pay for that. And we need like insurance or other models where, somebody who can't afford maybe to go to a nutritionist for 4 hours, because they're very expensive, it has to be covered, and the nutrition have to be reimbursed appropriately.
Yeah. At the same time, though, if we can keep kids healthy and we have healthier young adults over time, you're going to see less of a burden on the healthcare system. So you would think it's a good thing for society to have that approach. Do you see in our lifetime like this becoming somewhat mainstream and not something that's kind of at the fringe?
I hope so. And doctors are not the fastest group of people to change. There's a lot of studies that show that it takes, from the time you get a new new data point that's really well proven. It takes 10, 15, 20 years to really change medicine over into everybody doing that. Medicine is very slow to move the needle on what they're going to do. You know, hopefully as the younger generation moves in, there are more and more doctors who are open to this, and you don't necessarily have to practice it, but at least if you're open to it, learn a little bit about it, and hopefully we can start integrating that in. And that's one of my passions, and one of my goals is really to bring this to the forefront in the best way possible by integrating it in with evidence and science and research, and working with evidence-based practitioners to bring it more into mainstream. So I think if people start seeing it in that light instead of more woo-woo, then they're going to be open to it. And even in my practice right now, I just got another doctor who's coming in. She trained at Brown. She's super excited about integrative medicine. She hasn't learned like a ton of stuff yet, but same with me. When I first started, I didn't know a ton of this stuff. And if you're just open to it, then you can start learning and you grow. And it's hopefully we're like a tree and we bloom. And I'm also just about to do a summit. We got a whole bunch of celebrities involved. Hillary and Haley Duff are on it, and a whole bunch of other practitioners and doctors. And so we're hopefully going to get this mainstream. And I don't know how many people are going to see it. I hope a lot of people watch it. But if we get 50,000 or 100,000 people watch it this year, and the next year you get 500,000 people, and whatever it is, if people start to know that this exists, then they're going to go back to their doctors, and they're going to start to ask questions, and doctors will start to learn. And that's my hope, is if people want this, then hopefully they're not going to be so angry about it. They're going to learn a little more about it.
Yeah, it's amazing. I want to wrap up, but I have another, just what's going on right now with COVID-19 and the push to open up schools.
Mm-hmm.
There's this balance where some kids don't do great with distance learning, and they need that social action. They need to be around other kids. Yet there's other people that saying we're putting our kids unnecessarily at risk by forcing them to go back to school. Where is there a middle ground, or where do you see what should we be doing on that?
In my opinion, we have to have a long-term plan that we can evaluate that it works well for different areas, different locations, different school zones, something that's a unified plan that we can work together on. I think, well, pediatricians have come out very strongly with a statement in general that they feel that kids do need to be in school, but we need them to be in school safely, and we need the people in school to also be safe. And there isn't a great plan, and there's certainly no unified plan right now for that. And that's what we need moving forward. We need the teachers and everybody to feel safe, but we also need to get the kids back in school. And the good news, if there is any good news with Corona, is it still doesn't seem, for the most part, like it's very serious for most kids. Most kids, if they get it, don't have any symptoms. Most kids, if they do have symptoms, it's pretty mild, but you absolutely can have severe symptoms. You can get pretty sick, and you probably can infect adults, though it's, that information just keeps changing every week. But we still want to be cautious with this. And I think the concern is if you put a whole bunch of kids into school, a couple of them get it, they give it to the teacher, they take it home, they infect grandma, somebody gets super sick, and maybe one of the kids out of 1,000 or whatever gets really sick. And we don't want that. So we need to figure out a way that we can decrease the risk to eliminate it to as minimal as possible, while getting them the education they need. But there's never going to be zero risk. I mean, unless it's gone.
Kids go to school and get the cold, they get the flu, they get other illnesses at school. So going to school, you're always exposed to illnesses.
Right, exactly. So there, when you went to school before, there's the flu and people die from the flu, and we want to decrease that risk just the same as anything else. And so I think it's about making people feel comfortable, making teachers feel comfortable, making parents feel comfortable that the risk has been thought through. We have a good understanding of what the risk is, and we're doing everything possible to decrease that risk. And we have good protocols in place should somebody get sick or should somebody become positive, that everybody knows exactly what they're going to do. Just like a fire drill, everybody knows what to do if there's a fire. So then we don't feel so worried that we're going to go to school and there's going to be a fire, but there could be a fire, right? So it's the same thing. You just have to be prepared. If everyone's prepared, I think we can slowly start to go back, especially if, as we see people go back, then we don't see huge outbreaks. And from other countries thus far, from what I know, the places that are doing school, they haven't seen a lot of outbreaks, so that's good. And we'll see that. And if everybody goes back to school, let's say in September or October, and there's tons of outbreaks, well, then they're going to close them down. But if there's no outbreaks, then hopefully that's a good sign that there isn't going to be a lot of trouble there.
Yeah, hopefully we'll get our act together, and we'll make sure that we don't go down the path, and we can follow what other countries are doing. So far we haven't been the best at managing this COVID. So I'm
No,
with you there.
we haven't been the best. So I think we need a really unified plan. I mean, we need a plan. We need to come together. There's too much fighting. There's too much, he said this, she said this, so we're going to do this, we're not going to do that. Everybody has to come together with one unified plan, and we got to do it together. And whether that's at a state level or at a whole country level, it's not going to work if one city does something and then another, town 5 minutes away does something else. Okay, fine, you do a really good job, you knock it down, and then you drive 5 minutes and you bring it over there. Like, everyone has to do it together.
Fighting a pandemic should not be political ever.
No, it's a health issue, and it's ridiculous that we're not working together. And everybody has different opinions on what that working together should be. But I think at the end of the day, there is no question that we are one human race. We're all here together, and we have to do this together. And the countries that do it together have decreased their risk. And yes, America is very different than other places, and it's very big, and there's a lot of people in smaller places. Is obviously a lot easier, but it doesn't mean we can't have a unified plan and we can't work together.
I'm into that. I agree with you. I really thank you for this time. As I actually learned a lot, and I think what you're doing is amazing work. I really do. And as much as my hope is that more and more people hear your message, and this isn't controversial or taboo or anything. It's mainstream like everything else.
Yeah, that's
my
oh, you're welcome. Thank you so much. That's my hope too.
And if somebody's listening to this and they want to get in touch with you, what's the best way? And do you only work with kids in LA? Do you ever do any, like, if somebody's listening to this and they're not in Los Angeles, what's the best way for them to find an integrative pediatrician near them?
It's a good question. So for me as a doctor, you really have to work within your state. That's the rule. So we can't really do telemedicine. But you can find practitioners in your state too. And so I run integrativepediatrics.com, and on there we actually are just building a practitioner finder right now, because that's one of the things that I get asked a lot is if I'm in some other state, where can I go? So we're starting to try to bring everyone together and find practitioners. So any practitioner can sign up for free on integrativepediatrics.com and list themselves. So you can go look there. There's lots of groups online where you can search, or just ask in mommy groups on Facebook and things like that, where, do you have an integrative practitioner? You can go there. And then also we have our summit coming up at integrativepediatrics.com/summit, and that's in mid-August. And you can go there, and we have a Facebook group, and you can chat with people there too.
Okay, so anybody listening to this, we're going to have all of this in the show notes, and we'll also have a link to Dr. Warsh's website. Thank you so much. I really appreciate the time.
Thank you.